Have you ever truly wondered what goes on inside your ears? This small yet incredibly complex organ is not merely a gateway to the world of sound. It's also a unique ecosystem where surprising things can sometimes appear. In recent years, with advancements in endoscopic technology and the trend of sharing medical videos, the public has had the opportunity to witness rare, sometimes shocking, but undeniably fascinating medical phenomena. Among these are the images of giant blackheads hidden deep within the ear canal, a sight that has astonished even medical professionals and raised crucial questions about personal hygiene. Videos capturing doctors' reactions to these incredible obstructions are more than just entertaining. They serve as powerful reminders of the importance of proper ear care. What might start as an inconspicuous dark spot can evolve into a large, obstructive, and uncomfortable mass, potentially severely impacting hearing. This article will not only delve into the world of these impressive medical findings, but also provide a comprehensive scientific overview of daily ear hygiene and care, helping you avoid such uncomfortable situations and protect your auditory health. We'll explore common mistakes many people make, the correct methods recommended by experts, and profound advice to maintain healthy ears for life. Join Jamie Lee as we uncover the secrets of our ears and how to care for them optimally. Part 1. Giant Ear Blackheads, a remarkable medical phenomenon and the doctor's response. 1.1. The nature of blackheads and their appearance in the ear. To understand giant blackheads in the ear, we first need to grasp the nature of blackheads, comedones, in general. A blackhead is a basic skin lesion that occurs when a hair follicle becomes clogged with sebum, skin oil, dead skin cells, and dirt. When exposed to air, the sebum oxidizes, turning black, which gives blackheads their characteristic appearance. However, when we talk about blackheads in the ear, especially the giant cases often documented in medical videos, we are referring to a more complex condition. These are not merely typical blackheads, but can be the result of long-term accumulation of sebum and dead skin cells. Similar to facial skin, the ear canal also contains sebaceous glands and constantly sheds dead skin cells. Ceramin impaction. Earwax blockage. Earwax, ceramin, is a natural substance produced by glands in the ear canal to protect and lubricate it. Normally, earwax naturally moves out. However, due to factors like a narrow ear canal structure, improper use of tools, e.g., cotton swabs pushing wax deeper, or excessive earwax production, it can accumulate and harden, forming a wax plug. When this wax plug contains a lot of dirt and dead cells, the part exposed to air can oxidize and turn black, resembling a giant blackhead. Combination of old earwax and blackheads. In some cases, an actual blackhead may form in a hair follicle within the ear canal, and subsequently, it combines with accumulating earwax, creating a large, dark mass. Epidermoid cysts or lipomas. Although less common and not blackheads in the strict sense, in rare instances, benign, lumps under the skin within the ear canal might be mistaken for or have a similar appearance to giant blackheads if they become clogged and oxidized. What factors cause these masses to become giant? This is often a result of improper cleaning over an extended period, or due to individual physiological characteristics such as a narrow ear canal, excessive earwax production, or dry, hard earwax. When not properly cleaned or removed, they will continue to accumulate, compress, and grow over time. 1.2. The doctor's reaction. From astonishment to medical solution. When an ENT, ear, nose, and throat specialist, or a general practitioner specializing in ear care, encounters a case of a giant blackhead in the ear, the initial reaction is often one of surprise and sometimes awe at the size and extent of the accumulation. This is particularly true when the patient is unaware of the severity of the problem inside their ear, only seeking medical attention for discomfort, ringing in the ears, or mild hearing loss. The doctor's reaction doesn't stop at initial emotion. It quickly transitions into a professional medical diagnosis and intervention process. Initial assessment and endoscopy. The doctor will use an otoscope or, more commonly in complex cases, a specialized ear endoscope, videoscope, to meticulously examine the inside of the ear canal. The clear images from the endoscopy help the doctor determine the nature, size, location, and adherence of the accumulated mass. This is when the shocking images we often see online are captured. Determining the removal method. Depending on the characteristics of the mass, the doctor will choose the most appropriate removal method. Options include specialized instruments. For large, hard, or stubbornly attached masses, the doctor may use instruments such as alligator forceps, a curette, or a cerumen hook. This process requires high precision and skill to avoid damaging the ear canal or eardrum. Suction. This method uses a small suction device to vacuum earwax or debris out of the ear canal. It is a quick and effective method, especially for soft or semi-solid earwax. Ear irrigation involves using a special syringe to gently flush warm water, or saline solution, into the ear to soften and wash out earwax. However, this method is less commonly used for giant blackhead masses due to the risk of pushing them deeper or causing injury if the mass is too hard. It's also not recommended if there is a perforated eardrum. Earwax, softening drops. In some cases, the doctor may prescribe eardrops containing wax, softening agents, e.g., carbamide, peroxide, for the patient to use at home for a few days before their clinic visit to facilitate easier removal. Patient education. After successful removal, the doctor typically takes time to explain the patient's condition, the possible causes of the accumulation, and most importantly, provides instructions on proper ear hygiene to prevent recurrence. This is a crucial aspect that we will delve into in subsequent sections. The doctor's professional response is not just about removing the foreign object, but encompasses the entire care process, from diagnosis and treatment to preventive counseling, ensuring the patient's long-term health. 1.3. The effects of giant ear blackheads on ear health. A large accumulation in the ear, whether a blackhead, hardened earwax, or any foreign object, can cause several significant health issues. Conductive hearing loss. This is the most common effect. The obstruction prevents sound waves from reaching the eardrum, reducing hearing ability. The degree of hearing loss depends on the size and extent of the obstruction. Ear pain and discomfort. Pressure from the accumulated mass on the ear canal wall can cause persistent aching, fullness, or discomfort. Tinnitus. Many patients report ringing, buzzing, or hissing sounds in the ear. This can be due to pressure on internal ear structures or changes in how the ear processes sound. Ear itching and irritation. Blackheads, or earwax masses, can cause intense itching in the ear canal, leading to constant scratching, which damages the skin and increases the risk of infection. Vertigo. In rare cases, especially if the earwax mass touches the eardrum or puts pressure on the middle ear, it can cause feelings of dizziness or loss of balance. Ear infections, otitis externa. A moist ear canal with accumulated earwax is an ideal environment for bacteria and fungi to thrive. When a blackhead or impacted earwax is present, the risk of outer ear infection significantly increases, causing swelling, redness, severe pain, and possibly pus discharge. Difficulty with hearing aids. For hearing aid users, blackheads or accumulated earwax can reduce the effectiveness of the device, cause whistling feedback, or make wearing the hearing aid uncomfortable. Early recognition of symptoms and seeking medical intervention are crucial to prevent more serious complications. Part 2. Common mistakes in daily ear hygiene. Understand. To avoid. In an effort to keep ears clean, many people inadvertently make serious mistakes that can do more harm than good. Understanding these mistakes is the first step to protecting your auditory health. 2.1. Over-reliance on cotton swabs and improvised tools. This is perhaps the most common and detrimental mistake. Harmful effects of cotton swabs. Although cotton swabs are designed to clean the outer ear and earlobe folds, many people use them to probe deep into the ear canal. This inadvertently pushes earwax and debris further in, compacting it against the eardrum. Over time, this can lead to earwax impaction, causing hearing loss, tinnitus, or even pain. More dangerously, using cotton swabs too deeply or too aggressively can scratch the delicate skin of the ear canal or even perforate your eardrum, leading to severe pain.